We all need medical care at some point, right? Often when we least expect it.
Definitely.
But have you ever tried buying it like you buy groceries? Or a car?
No. It really doesn't work that way.
Exactly. So today we're going to dive into this really groundbreaking paper from way back in 1963.
Kenneth J. Arrow.
Yeah, Kenneth Arrow. It sort of brilliantly explains why healthcare seems to break all the normal rules of economics.
That's the one. Our main source here is Arrow's article, Uncertainty and the Welfare Economics of Medical Care. It was in the American Economic Review.
A classic.
Truly.
Yeah.
And our mission today is basically to unpack his main argument. He's saying that medical care isn't just, another product.
Right.
It's economically really unique. And understanding why it's unique, well, that's just vital for figuring out healthcare today.
Okay, so let's get into it. The first huge idea is uncertainty.
Yes, massive uncertainty.
I mean, when you buy, say, a phone, you know what you're getting, pretty much.
Right. You know the features, the price, when you'll get it.
But healthcare, you often have no clue if you'll need it or when.
Or even what the outcome will be if you do get treatment.
Yeah. Will it even work? You're buying a service where success is, well, it's far from guaranteed.
And think about it. Nobody really shops around for emergency surgery, do they?
No, you can't get 3 quotes for an appendectomy while you're doubled over in pain. It's just not how it works.
Precisely. And it's not just uncertainty for the patient. Arrow points out the physician also faces uncertainty.
About what specifically?
Well, about the exact diagnosis sometimes, how you'll react to a certain drug, what the prognosis really is long-term. It's complex.
Okay, so that leads right into the next big point, doesn't it? The information imbalance.
Exactly what Arrow called information asymmetry. It's huge.
Meaning the doctor just knows vastly more than the patient.
Vastly more. Years of training, experience. They understand the illness, the options, the risks in a way the patient simply can't, especially when they're sick and vulnerable.
Yeah, it's not like researching cars online where you can become kind of an expert yourself.
Right.
When you're ill, you're not really negotiating on equal footing. You basically have to trust the doctor.
That element of trust is critical. Arrow really emphasized this.
Because they hold all the cards, really. Diagnosis, treatment.
Prognosis, yeah. And that asymmetry, that imbalance, it completely turns the idea of a standard competitive market on its head.
So you can't just shop around, effectively.
Pretty much not for complex care, anyway. And Arrow didn't stop there. He also looked at other market imperfections.
Like what?
Well, like the fact that risk itself is hard to sell or insure properly. The non-marketability of risk, he called it.
Meaning?
It's just really difficult to create insurance that perfectly covers every possible health outcome or guarantees a cure.
Right, you can't buy a policy for guaranteed wellness.
Exactly. So pricing that risk, transferring it efficiently, it's incredibly complex. That's why health insurance is such a beast, often needing mechanisms beyond just simple market buying and selling.
Right.
And even information, like a diagnosis or treatment advice, you can't really package and sell that easily like you might sell, I don't know, financial data.
So the risk and the information needed are kind of slippery, economically speaking.
Very much so. Then you look at the supply side.
What did Arrow say about that?
He pointed to things like professional licensing. You need a license to be a doctor.
Which makes sense for quality, of course.
Absolutely, for safety and quality.
Yeah.
But it also restricts who can practice. Same with limits on medical school spots, entry restrictions.
Ah, so that limits the number of doctors available.
Right, which isn't how a totally free, competitive market would operate. It affects supply, potentially prices, availability.
And hospitals too, right? Many are nonprofit.
Yes. The role of nonprofit hospitals is another unique feature. They often have different goals than just maximizing profit. Community service, maybe a religious mission. That changes the economic dynamics compared to, say, a for-profit company.
Okay, so putting it all together, you've got deep uncertainty, huge information gaps, difficulties trading risk, and these unique supply controls like licensing and nonprofits. What does Arrow say this all means for the big picture? For, like, economic efficiency?
Well, this is the core welfare economics point. Because of all these unique characteristics, the standard economic idea of an optimal outcome.
Where resources are allocated perfectly efficiently.
Yeah, what economists call Pareto optimality, where you can't make anyone better off without making someone else worse off. That concept just doesn't map neatly onto healthcare.
Unlike apples or cars.
Exactly. The usual market forces we rely on to get us towards efficiency in other areas, they just don't work the same way in healthcare. They're fundamentally challenged. Leaving it purely to the market often won't lead to the best outcomes.
So the main takeaway is medical care is just built differently, economically speaking,
Fundamentally differently.
shaped by this deep uncertainty, the information problems, the specific ways supply is structured. It's not just another commodity,
That's Arrow's core insight, and it's still incredibly relevant.
which really makes you think, doesn't it? How can understanding these economic quirks identified way back in 1963 help us tackle today's massive healthcare challenges? Things like access, cost. How do we think about the future of healthcare knowing it operates by such different rules?